Okay, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. You're laying on your side and your left arm is up in the air in a shoulder holder. To the right of the shaver is the biceps tendon. This biceps anchor is one of the things we were concerned about, and sure enough, you've got this type of tear that I think we can help you with. The rotator cuff is up here, and I'll tell you what, on this side it doesn't look that bad. We're certainly going to have a look on the bursal side, but at least here it doesn't look like it's peeled away from the insertion at all. The insertion is right at the edge of the articular margin, and that looks pretty good. Now we know from our imaging that there's going to be some tearing right in this region on the other side, but I'll show you how we determine that. As far as the rest of the joint, no significant arthritis. The humeral head here looks pretty good. As we go around to the back side of the shoulder here, that all looks good. There's the glenoid down below. Cartilage looks good. And now we're going to go ahead and take a spinal needle and pass it through this biceps tendon, and then we're going to use what we call a super shuttle. So there's our first pass through the tendon, and then we'll take a super shuttle and a grasper and then a hi-fi. Here's the relay coming down, grasper, and then we'll use the hi-fi. We're going to grab the wire. Before we pull the wire out, we back the needle out. I got it. Yeah, okay. And then outside your shoulder, we're going to load that black wire. It actually has holes in it at different intervals so that we can feed suture through it. And if you look now at the wire, I'm pulling back on it. If you keep looking, in just a minute, you'll see kind of a greenish colored suture. There it is right there, or blue. And that's our first pass. Now we're going to do the same thing one more time. Okay, so I want to show you, we've got the biceps secured. We've taken away that labral tear, so that can't come back anymore. Now we're going to take a spinal needle and pass through the area of the cuff, where if we do have to do something to the cuff, it'll be in this region. If you look, on the screen, it's going to be basically just to the left of the biceps tendon, right about here. So we're going to pass right through there. We're going to pass our marker stitch through there, which is just a purple absorbable suture. And then we'll go ahead and switch positions. Okay, so we're in the subacromial space. Posteriors to the right, we have our burr coming in. Anteriors to the left. Your clavicle, hold that right there. Your clavicle is right here as I push on it. So that's the AC joint right there. As I rotate the camera to the left, we can see that your acromion kind of has this downward slope all the way to here. You can see that this is bone right here, and it's pretty close to the cuff. And you can look down at the cuff, and you can see when we rotate the cuff, how it could get scuffed up going underneath that bone, especially when your arm's raised up. Right now, your arm's at your side, so it only gets tighter than what we see right now. This is the most space you have. Our marker stitch for your rotator cuff is right there, and you can see how this cuff is torn here. Okay, and that's what's happened, and that's what our imaging also showed, and that's why we're here today, to fix that, because you've got this significant partial tear in the cuff, and like in a lot of these situations, it's this bone spur right here that's the culprit. So what we're going to do is we're going to take this And you can kind of see just that quickly, that spur that was here is now gone. I'm going to make sure we get lateral, because sometimes there can be a lateral overhang that can also pinch on the rotator cuff. Okay, and so right out of the gate here, I'm real happy with the way that looks. I think we've done our decompression there. Okay, now we really only do something to the clavicle if there's evidence that it's pinching on the tissues. It looks like there's plenty of space here. We can do what we call a coplane. Which is really just beveling this bottom edge. Okay, so here's the marker stitch. Remember I said we were going to place kind of a purple marker stitch? There it is. Here's the tear. We're going to go ahead and remove the marker stitch now. And then we're going to do what we call unroof the tear. It actually really doesn't take much. It's already completely torn. So there's a classification system where we grade this based on the articular appearance, which for you it was good. It was what we call an A0. And then we base it on the bursal appearance, which is a B4, which means that it's basically a full thickness tear from the bursal side. So this would be an A0 B4 tear in the Schneider classification system. And you can see as we work our way back, now you can see there's the articular surface, and now we get a really good idea of how delaminated and damaged this tendon really is. We're going to try and repair all those layers back at once. Okay, so as we record and lift up on the tear, you can see that's the complete thickness of the cuff. We're going to place our suture anchor. That's the articular margin. We want to come back just a little bit. We don't want to be way over here lateral. That's too far. We'd like to be right about here. So we'll go ahead and take a scalpel. And then there's our guide coming down. Pull on the bicep sutures, please. Okay, and same thing here. We can lift up. And then as we place this, that's a pretty good angle right there. Go ahead. Okay, so here's where we're at. We've got our anchor down in the bone. We've got one suture inside this anterior cannula. This is the full thickness of the tear. Hold right there. And now we've got a suture hook coming in from the back. It's loaded with that same black super shuttle we used for your biceps. And so we're going to pull back here. And there we are getting all the way underneath. That's what we want to always make sure we do. And so we'll go ahead and retrieve this now, and then we'll tie this and show you some more in a minute. Okay, so we've got the cuff repair. Let me just show you. We've got one anchor and 3 very strong sutures holding the cuff down to the bone. Let me turn off the flow quite so much. Okay, and so one suture there, second suture there, third suture is going to be back over here. And then those sutures you see inside the cannula for the biceps tenodesis, for the biceps tendon. That third suture is basically right there. So when we move your shoulder now, the rotator cuff is fully repaired. We've still got to tenodese the biceps, which is why I placed those sutures inside the cannula. And we're going to use a suture anchor and place down those sutures basically into the bone right about here. Okay, so we'll show you some more in a little bit. Okay, so now we've got an anchor, the smaller one. Do you have a small little 2 millimeter? So now we've got the biceps Tenodesis. There's the anchor. That's solid. That looks good. And then the final little thing we do to try and maximize our healing is to make some little bone marrow vents in the bone. We'll do one here, tap. All the way to the hub, which is more. Right there, okay. So there's one. With this size tear, probably 2 is plenty. Go ahead. Go, okay. You can already see some of the little bone marrow elements starting to come out, even though we haven't turned off the pump yet. Maybe do one more right here. Okay, a little more. Okay, there's 3. And so now when I turn down the pump pressure, you'll really see how these work. If you look at these little holes, you'll see some of the marrow elements start to come out. There they go, right there. Okay? All right, good luck to you now. Bye-bye.